Over the next 3 days, we're going to be sharing stories from our new series, Survival of the Smallest, which is a direct focus on the work that's being done in North Texas right now to improve outcomes for both mothers and infants. Andrea Lucia now to get us how this all started.
That's her favorite.
Collins Kennedy is the girl her parents wanted so much.
It took us over a year to get pregnant, so we were really, really excited.
Yeah. And then we found out.
The doctor said there were severe complications with her brain. She had a lot of fluid instead of her brain developing properly. So these are her tiny little feet. I just really wanted to keep these in case she didn't make it.
No one was quite sure how long she would live, and her parents, Kyle and Bailey, prepared for the possibility that they would lose her shortly after birth.
It's been a journey.
But Collins pulled through.
She stopped breathing
She stopped breathing a few times.
I mean, it was probably 9 months of just kind of being really stressed.
Taking it day to day?
Yeah, just day to day.
And against all predictions, she celebrated her first birthday this past August.
Happy birthday, dear Collins.
When it comes to the survival of its smallest residents, though, Tarrant County has struggled. In the same zip code where you'll find Fort Worth Medical Center, a University of Texas study found the highest infant mortality rate in the state. Out of every 1,000 babies born to women living here, 19 were dying within the first year. That's roughly 4 times the national average.
We are right next to it.
We're right next to it. It includes all the major hospitals in Fort Worth.
Yeah, that's what makes it so odd. You can literally see where we're sitting, and yet the moms in that zip code just have these horrific results.
So what is it? Why is that community?
It's a collage of things. It's such things as food deserts. It's healthcare access from an uninsured point of view.
According to the U.S. Census, nearly 30% of residents here are uninsured. That's roughly twice the state average and 3 times the national one.
When you're uninsured, you have to find some place that will actually see you, and the place they have to see you is in the emergency room. We have moms in this community who literally show up to the emergency room in labor and have never seen a physician for 9 months.
Those mothers miss out on possible interventions to address conditions like diabetes, anemia, and vitamin deficiencies, all of which would reduce the risk of complications. More recent data shows it's not just a local problem. For the first time in a decade, in 2022, both Texas and the nation as a whole saw an increase in infant deaths.
For a long time in Texas, there haven't been enough women policymakers at the table.
The youngest mayor of a major U.S. city, Fort Worth's Maddie Parker, is a mom herself and says the numbers trouble her.
And I felt a sense of urgency around an issue that I think, as I mentioned before, our community has really struggled with for decades. Why do we have one of the highest mortality rates in the country?
To tackle the problem, 2 years ago, she formed the Tarrant County Maternal and Infant Health Coalition, made up of local health leaders and nonprofits. Among other things, the coalition has worked to enroll more patients in Medicaid. And in the last few months, it's teamed up with Dallas County health leaders in pursuit of what's known as an ARPA-H grant.
It's a federal grant, it's brand new, it's very large, and it's outcome driven. Very unusual for...
So you have to show some success
we have
prior to...
Oh, very specific success, yes.
Okay.
It's all metric driven.
The chance to bring in $45 million for local research is turning rivals into allies.
This is Dallas and Tarrant County working together. That in its own right, in my career, is unheard of.
One initiative kicking off soon that the grant would go toward will aim to provide every pregnant woman in the DFW area with free iron pills. Supplies are already arriving at local hospitals. The effort is based on research performed at Parkland Hospital that drastically cut the number of women needing blood transfusions during birth, a procedure that comes with risks.
But they showed they give moms this iron pill every day. They give it to them free. They don't ask them to go to CVS. They don't ask them to buy it, because if you did either one of those, it's not going to happen. They reduced their transfusion rate 1/3.
If hospitals can show similar results across North Texas, it could become the norm.
I'm predicting this will become a standard of care for pregnant moms.
Nationwide.
nationwide.
Our ultimate goal is visionary. We want the lowest mortality rate in the country. We want to be an example for hospital systems and communities and healthcare providers across the country, what it looks like to care holistically for women and children in their communities.
You got lots to say?
The Kennedys hope North Texas gets its grant and continues its work so more families can see the success that Collins has.
She's such a blessing and a joy, and so we're just really thankful that she's here.
Those free iron pills are just one initiative the coalition here is working on. It's also launched an app called Parent Pass that helps connect parents with all kinds of information on local resources. 7 hospitals have also recently adopted something called Team Birth. It's a planning board providers use to centralize information on a patient who's in labor. There's also been an effort to better train providers to respond to specific birth complications. And there have been specialized units created to address issues affecting new moms' health, everything from hypertension to food access and even postpartum depression.
Andre, can we talk about the money side for half a second here? So this $45 million federal grant that you talk about, I'm curious whether or not it's affected in any way by the Trump administration's big federal funding freeze that's going on right now.
Yeah, the short answer is we're not sure. It's definitely a concern. The process, at the very least, seems to have been delayed. TCU, which submitted the application on behalf of Tarrant County, was initially expecting to hear back this month. It is still hopeful that this money's going to come through, though.
Okay, so it's a wait and see on the 45 mil. All the major hospitals, though, we know here in Tarrant County involved in this, all the top leaders in the field as well. But also you're understanding that some young aspiring doctors are jumping on board as well.
Yeah, TCU has its Burnett School of Medicine, and some of their medical students are basing their research projects around this topic of infant survival. We're going to take a look at a couple of those projects tomorrow.
All right, part 2 on the way. We appreciate it. Great insight. Andre, Lucia, big thanks to you and the I-Team. And if you're interested in learning any more about infant death rates where you live right now, we've got this really great interactive map that's going to show you rates by county, and you can choose yours and see where you stand. That's on CBSNewsTexas.com.